Welcome back to the Morning Brief on Channels Television. And you know, for good reason, in the past 2 weeks or thereabout, we've been staying with the cholera outbreak in Nigeria. And with 1,523 cases or thereabout and 53 deaths, the cholera outbreak is indeed taking on the nature of a public health emergency, the second public health emergency, and you know, for which in the manifesto of the current government there was a promise for a coordinated action plan to tackle any public health emergency. And so suffice it to say that this would be, you know, a good test for that. But is there a coordinated response for the cholera outbreak to tackle it? Let's have that conversation as we have joining us the Minister of Health and Social Welfare, Honorable Ali Pate. Professor Ali Pate. Professor Pate, thank you so much for joining us on the program.
Thank you for having me.
Indeed. So before we begin to look at a declaration of an emergency by the NCDC, let's take a step back, you know, and look at perhaps from 2022. I've been looking at the NCDC's monthly report, about two, and in November 2022, there was at least 1,393 cases, and in November 2023, there were about 3,000 plus cases reported from different states of the Federation. So the question would be, you know, having these reports, how much of this cholera outbreak caught us napping in terms of preparation, considering the fact that the WHO has declared this disease a poverty disease?
Thank you. I think let's step back before we get to the numbers. That we're constantly being challenged by infectious disease outbreaks in Nigeria. And that's why this administration had a four-plank agenda in terms of improving governance to work between federal government, states, to improve health services so that population health gets better, and to unlock the value chain so that we can produce much of what we need. In addition, to focus on health security in a coordinated way so that we can detect disease outbreaks and respond to them effectively. We did that with diphtheria, as you recall, late last year, and early this year when meningitis struck, we were able to decisively come around it with the pentavalent meningitis vaccine and stop it. Now, the cholera outbreak that we are facing in this instance is part of a global phenomenon. As you know, we're in the 7th cholera pandemic, and this year alone, WHO reports more than 200,000 cases of cholera in 5 regions of the world, including Nigeria. Earlier this year in Southern Africa, lots of cases, but we are now beginning to see the uptick in Nigeria. Once that started in Lagos, in Ogun, through the Center for Disease Control, NCDC, the technical working group was activated, which comprises multi-sectoral content experts, states, but also our development partners, technical agencies, to mobilize so that we can support those states to reduce the transmission and treat those who are affected. At the end of the day, cholera is a public health crisis, but it's also a disease that comes in the context of contamination of food, of water, of poor sanitation, of developmental challenges, and deficit in infrastructure. So we have to think about that as well. And open defecation is prevalent in many parts of our country. That is fueling this effort. So in responding to that, the Emergency Operations Center, which was activated by the NCDC this week, for instance, is to really get ahead of this outbreak so that we numb it. And the government also appointed a cabinet committee to mobilize across sectors: water, environment, agriculture, youth, health, and others, to really come together and work with state governments so that we can decisively stop this outbreak before it consumes a lot of our populations. But in the wider context, the health security of Nigeria requires us to be very sensitive and to have good surveillance systems, which at this moment they are strong. That's why we are able to pick these infectious disease outbreaks and be able to mobilize the resources to respond to that. But we have to be vigilant continuously. Otherwise, we could be surprised by infectious diseases.
Well, Honorable Minister, even though it's a global public health emergency, it's just important to point out that within the 2 years of Nigeria reporting, the infrastructure deficit ought to have been covered significantly to reduce the number of cases. Now, concerning the activated center by the NCDC for the tackling of the cholera emergency, will there be funding released by the federal government to manage this response?
Yes, I think we had anticipated the seasonal outbreaks, and several months ago, the president, in his wisdom, approved pre-positioning of contingency financing to the Nigeria Center for Disease Control, so that we are ready with the resources, and that's what has been used so far. And this committee that has been formed, I believe that we would have additional resources mobilized, in addition to the technical and financing partners who are also joining in, because infectious diseases do not respect borders, and therefore it's a collective effort. The states, I think, also have an important role to play to release their own funding to the state health facilities to deal with the cases in their respective domains.
But Minister, you talked to State House correspondents yesterday while you said that the president has already approved the creation of the committee to tackle this issue. But we see that the concentration of most of these deaths and cases happening is in the southwestern region. Is there any plan by this committee to concentrate on some of these areas that need help mostly?
It's a national emergency. 31 states are affected. 107 local government areas are affected. And that's just where we are today in terms of the outbreak. It could get a lot more numbers, but we hope that it would be numbed by the efforts that we are putting in place. Now, there is focus already on Lagos, and I have to call out the Lagos state government for really being on top of it right early on, and with the support of NCDC and this technical working group that existed at NCDC, they are able to minimize the impact of this. Similarly, Ogun State. So the Emergency Operations Center uses data to figure out where are the cases and to be able to mobilize resources so that we can contain the issue where it exists. We cannot spread ourselves all over equally across the country, but at the same time, if we don't get those other states ready, we could intervene when they are much more advanced, and that would be unfortunate. So that's the idea of this national effort. Now, bringing the state governments is also important. Some states have done a lot of work on open defecation. Jigawa State is one of the states, in fact, is a state that was declared open defecation free in Nigeria. And so there are lessons to be learned, because we have to deal with open defecation as a problem. A quarter of our population still practices open defecation. Of course, there are differences across the states and between urban and rural areas, but we need to mobilize collectively as a people, public sector, private sector, to really address this and to encourage the behaviors of our people so that feces do not come into contact with water that people drink or the food that they also consume.
I would also talk about open defecation. Of course, this is the rainy season already, Minister, and we know that there are so many flood-prone areas, for example, Ogun State and even Lagos State. How well is the federal government working with state governments to ensure that potable water at least are provided, especially in rural areas where sometimes government policies are not implemented? Some of those people are even forgotten. People come to them, they make claims that they're going to do something, especially during campaigns, and immediately they get into power, they forget these people. So what is the federal government doing to ensure they work with these states and even local government areas and local government chairmen to make sure that some of their priority projects will be providing water for these people?
Well, in the context of our federal system, there are some responsibilities that are primarily of the local governments. Waste management, hygiene and sanitation aspects of it depends on local governments and depends on states. And many states have environmental protection agencies, and I believe that those agencies have to function in addition to what the local governments would do. from the federal government level, because we look at the entirety of the national health system, I think we have to ensure that we deploy resources, and my colleagues in the Ministry of Water Resources, for instance, are working to expand availability of potable water, as well as things like mobile sanitation facilities, like mobile toilets. But those are not by themselves sufficient without the contribution of the states and local governments.
I'd like us to look at the federal government's strategy. A lot of people might want to borrow from the ongoing football competition and how you look at the strategy of a coach, and you can almost tell if this team will do well or not. You look at the attack line, you look at the defense, the midfield, and the overall strategy. Now that there's been this interministerial committee to combat cholera, what exactly is the strategy? Who is doing, will I say, the heavy lifting? Who is doing what? How will there be coordination such that we'll come up with goals? Let me not say goal. We'll come up with goals, and we'll make sure that cholera is something that hopefully will not disturb us as much anymore.
There are various parts of government that intersect with this issue. On the preventive side, Environmental Ministry has a very important role, working with the states. And I mentioned the Water Ministry, which has an important role in terms of potable water supply, and also sanitation, which is housed there as well. Food security and agriculture, in terms of food safety, in addition to what we do in the health sector, which is on the prevention, the regulation of foods, but also on the treatment of those who are affected with oral rehydration solutions, with training of the health workers, with laboratory testing, with the public health responders, the epidemiological tracking, the data. The Youth Ministry, for instance, has an important role in terms of mobilizing society to deal with this issue of open defecation. I think there's a lot of scope to mobilize all actors, not only public sector actors, not only federal government actors, but civil society and the private sector, so that as Nigerians, we say we can reduce the rates of open defecation. And there are good examples of how this has been done. India, for instance, was able to construct 110 million toilets within 5 years, which provided toilet facilities for more than 600 million people. So Nigeria, with our population, if we commit, not only the federal government under the leadership of the president, but also the state governments and also private sector and our development partners, we can be able to address this so that in the years ahead we see less and less of this issue. And it's not only cholera, by the way. There are other infectious diseases like typhoid fever, for instance, that also affected. Tuberculosis, that is also a disease that sometimes is associated with housing challenges. So as we improve the physical infrastructure, the urbanization and the utilities that are backing that up, we should begin to see healthier population. And we need to do that in a multi-sectoral, whole of government and whole of society way. That's the spirit of the health sector renewal investment initiative that the president launched, as you recall, last year.
We'll eventually expand the conversation to talk about the general state of the health sector, which is also at the heart of this. But I'd like you to maybe provide insight into this thorny issue. The WHO has described cholera as a disease of poverty. Now, if you check maybe literature, you see that poverty was first discovered in the 70s in Nigeria, came back in the 90s, and we've been seeing, the regular visitations. Now it's become yearly, literally. We saw how we handled COVID, how we approached COVID when COVID reared its head in 2020. Everybody came together, and we found a way to ensure that COVID at least was not as lethal, or is no more as lethal as it used to be, but not the case with cholera. And there have been questions as to, is this because it's a disease of poverty? That's why a lot of attention is not being paid to it as it ought to, or at least as we saw COVID get that attention. Is that what you perceive on your side as well, Honorable Minister?
There are many diseases that are socially determined. There are diseases that are diseases of largely excluded populations who are vulnerable and poor, who live in inadequate housing with low sanitation, who don't have enough food, and so they are malnourished, or whose occupations exposes them to certain disease conditions. And so to address population health There's the aspect of the biomedical, which for certain diseases we handle, but there are some that go beyond that, that are multi-sectoral in terms of the determinants of why those diseases occur and how to respond to them. At the end of the day, we need to grow our economy. We need to translate that growth into incomes for households. We need to also build the infrastructure, the base for the urbanization that we're seeing, so that people will have good housing, good nutrition, safe spaces, proper mental health, in addition to access to health facilities that they can afford to get quality health services. So health is one thing that is, it's not just a biomedical issue. There is health in almost all public policy arenas, whether it's on transportation, whether it's in housing, whether it's in agriculture, environment, or whether it's in youth, or even the gender dimensions of it, to ensure that women are not left behind. And there are vulnerabilities that perhaps will have to be addressed through social protection mechanisms to ensure there are safety nets for those who are left behind. It's a whole of government and whole of society effort that is necessary to improve the health and well-being of any population. And that is what the president is trying to do as part of his renewed hope agenda, so that we grow our economy, we invest in the infrastructure, we have a stable macroeconomy, but we also have this focus on the human being, on their health, their education, and their well-being, and we don't leave anyone behind. That's the direction of travel, and we're executing that. And the interministerial committee that he formed yesterday is one manifestation of that, as a team within his administration, and also partnering with the states as well as local governments and other partners, so that we move ahead collectively.
And so, Honorable Minister, I'd like us to step back a bit again, from this side, from my own end, and look at the response of the immediate past administration to managing the public health emergency that we had in 2020 and 2021. And you recall that at that time, there were funds raised both from the private sector and the public sector for the management of COVID-19. And there were conditions and guidelines given for the disbursement of those funds, one of which was appropriation before the funds would be released. I wonder what you have in your handover notes, Honorable Minister, from the immediate past minister, on how well those funds were utilized. And giving a breakdown, sometime in 2021, the past Minister of State for Health said of the 500 billion naira stimuli funds that was released, 126 billion naira was released to build a resilient health system. Now, from what we have now, can you say that there is justification for the disbursement of a whopping 126 billion naira to build a resilient health system in the country?
Well, COVID-19 was an unprecedented global pandemic. It's a 1-in-100-year crisis that the world faced. And the global GDP collapsed by more than 5% in 2020. Many governments, including Nigeria, responded with various instruments in their hands. And Nigeria's government at that time responded equally, with huge infusion of resources, not only for health, but also across the social domains, to ensure that the impact of the pandemic is numbed. In terms of our health system, the efforts that we're building on right now to improve the quality of the primary healthcare system, to strengthen the Center for Disease Control, the laboratory capacity, the testing capacity, that the human resources, the field epidemiologists, are all building on some of what had started during COVID. But we need to go beyond that. We also need to produce some of what we use in terms of containing such outbreaks, whether they are masks, whether they are protective equipment, whether they are basic things like drugs that we need to manufacture, and in the long run, even vaccines against the infectious disease threats, or at least the capability to be able to produce those vaccines. So it's a continuum, it's an evolution. We experienced something that is unprecedented, and even the wealthier countries struggled. I cannot vouch for exactly the specifics of what you referred to, but I know that the government at that time tried to respond to an unprecedented challenge and did its best. And this administration is building on that to take Nigeria to the next level.
But Honorable Minister, if those funds were indeed judiciously spent on all of these areas of public health infrastructure that you talked about, why would this administration be needing to release another 25 billion naira to the National Primary Healthcare Development Agency for the rehabilitation of primary healthcare institutions currently?
Well, you have to understand that as a country, we have not really invested enough in the health infrastructure and equipment for decades. We spend very low amounts of money per capita on health. So while what you quoted may appear large in quantum, but we're a country of 228 million people. So per capita spending on health is still relatively low. President Bola Ahmed Tinubu increased the domestic resources this year, and we hope that as we implement, we'll mobilize more and double down on that. So the issue is, within what we spend, how do we prioritize it to respond to the needs of the Nigerian population and to ensure we build the resilience when we are challenged with outbreaks? Many of the successes that we report, in a way, are in diseases that don't get out of hand, the counterfactual that we cannot prove. For instance, when we had the meningitis pentavalent, the meningitis outbreak early this year, which affected, unfortunately, less than 2,000 population in a few states, we mobilized and deployed vaccines, and that outbreak did not escape to go into tens of thousands of Nigerians. That is the counterfactual, what could have happened. But because we were able to respond, it didn't happen, and it doesn't make into the news. Diphtheria was a major issue late last year. We vaccinated in 14 states, outbreak responses, huge efforts, and we've stopped that. It doesn't make it into the news, but that is a disease, a badness that was prevented. And so that is not as visible. And the few cases, for instance, on the cholera, we have 1,528 cases. That's still too much relative to the 200,000 that is in the world today. I think in this year, I think Nigeria is just beginning. We hope that it doesn't go beyond that, but it could have been a lot more without the efforts that have been made in the past, but also without the efforts that are currently underway to ensure that the trajectory of the outbreak is minimized so that it doesn't make a lot of damage to our population. We have to remain vigilant, and health is not cheap. Quality healthcare is not cheap. We need to invest in it, and that's what the president is doing, and that's what we are committed to, and we keep asking that state governments also join us in investing in health so that we can ensure the health and well-being of all Nigerians.
I'm glad you talked about the investments in the health sector by the president and, of course, the federal government. So now we're talking about accountability. How is the federal government dealing with making sure that MDAs and public organizations who are supposed to handle these funds and get results are checked? We're talking about accountability. How is the federal government ensuring that at least when money is pumped into something, results are gotten, not just results, but positive ones that are going to make a difference?
Yes. So I'll give you an example, a specific example. The Basic Healthcare Provision Fund, which channels resources to 8,800 primary healthcare centers. These centers are at state level and in the realm of the local government, but they are managed through a ministerial oversight committee. When we came in, we assessed, we audited, we looked at the Auditor General's report, we saw the deficits in many states, we engaged the Economic Council, the state governors, we engaged the commissioners, and they had action plans to respond to the weaknesses in their fiduciary systems. And when we disbursed for the first quarter of 2024, we did it in public, and we called EFCC, ICPC to keep an eye, and we provided a hotline, an email, so the Nigerians in the front ends report if there are adverse or diversions of those funds. That is so that everyone is kept honest in terms of the use of those public resources for health. At the end of the day, the resources have to reach the population. And if there's collusion in the front end, if a health worker manning a primary healthcare center takes some of the money and gives it to the senior level official, that is something that it's Nigerians that will have to report that. So we made that publicly available, and as we move forward, we're going to have the quarterly reports that we had signed in a compact with the state governors. The strategic compact that was signed on December 12, 2023, during the unveiling of the health sector renewal investment initiative by the president, so that we are constantly tracking and trying to improve in terms of the accountability measures and the answerability for all actors in terms of the resources that they're using. But Nigerians themselves have a role to play. To track those resources in the domains, in the local governments, in the primary healthcare centers. And if there's a diversion, to basically alert the relevant authorities to investigate allegations and be able to deal with them. Dealing with these issues are a continuous effort. It requires strengthening our institutions, which we are doing in government, but it also requires behavioral change from Nigerians to realize that we all lose if we allow few individuals to divert what is meant for providing basic health services in primary healthcare centers. That's just one example of what this administration is trying to do to sanitize the health system.
All right, thank you for that example, Minister. But let's come to you saying that Nigerians must also hold these institutions accountable. For example, primary healthcare centers, you mentioned how Nigerians must also say if there's a deficit or there's a problem or mismanagement. Some of these primary healthcare centers do not have the basics. For example, the fluid, the drip, which is meant to at least treat this cholera outbreak. Some of these primary health care centers do not have it. Some of these states are not even offering free medical treatment for cholera. What would you say about that?
I think this is a question that each state government, because you said, should be able to respond, because health is a responsibility of the federal government. It's also a responsibility of states and local governments. What I've shared with you is what the federal government is doing, its investments, including the Basic Healthcare Provision Fund, the resources that we've been able to mobilize. And we expect that states will also complement the federal government and do what the president is doing in terms of investing more in health and ensuring the human resources are there, the commodities are there. From our side, the federal government makes a contribution. All the states of the federation received some medical commodities from the federal government in response to this cholera outbreak. But at the end of the day, it's all of us joining hands that will make this work.
You made a very vital point, and I think these are the truths we actually need to talk to ourselves about. How quality healthcare is actually expensive, really. It's money. You pay money to get this service at any level. So can Nigeria really afford and pay for the quality healthcare that the people deserve and demand, such that you find government officials, even the president, seeking their health needs here in Nigeria, all of them? I was looking at the budgets for the U.S., for example. In 2022, the U.S. spent about plus $1 trillion on healthcare, $1.5 trillion. In that same 2022, Nigeria spent 800 and something billion naira. At least we topped it up in 2023. We spent plus 1 trillion naira. But that is in nowhere near what the U.S. spent for the quality healthcare that even the people say could be better. So really, if we must afford, if we should and will afford that quality healthcare that we deserve and demand, can we afford it as a country, as a government, or what options are available to us?
Yes. So quality healthcare, as you alluded to, is not cheap. You have to invest in it. And if we take the $2 billion that is in outbound medical tourism and just return it to use it in Nigeria, that will more than double the federal government's health spend, for instance. That's just one example. But let's step back and say the proportion of our revenue, of the our GDP, our economy, that we get in government revenue is among the lowest in the world. So if we pay the taxes and we reduce all the leakages, let's say, in terms of government revenue, government and the Ministry of Finance will have more resources And of that increased resource that it has, it can allocate more of that to health, more of that to the states, and the states will be able to allocate more to the health sector. But it also needs to grow the economy. If our economy doubles, for instance, as the president envisions, then we'll have more resources coming to government from that growth of the economy. And we can prioritize health and education within that and allocate more of that. But if our economy is not doing well, for instance, as we've seen over the last several years, then the pool of resources available to the finance ministry is limited across multiple challenges that it has to contend, whether it's infrastructure, whether it's security, whether it's health, whether it's education. So bottom line, as a people, we have to commit to come together and see how we can ensure that our economy grows in an inclusive manner, and within that growth, that we have revenue that is due to government comes to it, and within that to prioritize investments in health. And if we do that, then we'll begin to see the quality infrastructure, the quality human resource, and the commodities. Having said that, even within the existing resources, and the president increased the resources this year for health, for instance, we made some very significant moves in terms of infrastructure for cancer care, for cancer equipment in 6 geopolitical zones through our partnership with the NSIA. We are revamping many of the teaching hospitals. We are expanding the primary healthcare centers, retraining 120,000 frontline health workers, and also building the infrastructure for us to produce some of what we need, so that within the resources that we are spending, we don't have to buy things that are manufactured elsewhere that we can produce here, which may be cheaper and more available because we just minimize the cost of even logistics. Those are the ways that we're trying to use the available resources, use it well. More health for the money that we have, even as we look for more money for the health that we need to achieve the quality health system that Nigerians deserve. And this is what the president is trying to do.
So obviously Nigerians, its organs, government need to do more work, or maybe be more creative in ensuring productivity. So while we're doing all of that work, we also must not overlook the major challenge of corruption that has bedeviled the sector for years now. Lack of transparency, accountability. Take health workers, for example. Most of them are gravitating to where they will get more pay, because for them, they have to offer their service for pay anyway, and they'll do it to the highest bidder in court because they have needs as well. So the corruption we've seen has also impacted. Yes, we've not been as productive as we ought to, but we've also not used the little we have judiciously. I remember, I think it was in January, that the Public Accounts Committee of the House of Representatives was saying that there are some ministries that need to return COVID-19 monies. I think for the Ministry of Health, it was 10 billion naira. And it ties back to the question Bukola asked about the handover note. Did you see some of these things in the handover note? What was said about it? Were the monies really spent? Were they not spent? How did you respond to that request by the Public Accounts Committee? And by extension, how would you respond to the health workers out there who were saying, we need more pay. This needs to come today. You had promised, but how soon is that coming? So it's a two-pronged question, Minister.
So specifically on the 10 billion naira that was allocated in 2021 during the COVID-19 response by the previous administration, this was money to be channeled towards production of COVID-19 vaccines through the Biovaccines Nigeria Limited, which is one of the companies that exist in Nigeria trying to manufacture vaccines. It was in the interest of domesticating the manufacturing capability. That money has been around and has not been used. When we came into office, we looked at it and we decided that the resources should be used for the intended purpose, but it should be through the right entity in government that holds government shares in the Biovaccines Nigeria Limited. So that money is intact in terms of being available for Biovaccines Nigeria Limited. But that's not enough for Biovaccines to start manufacturing vaccines with it. It has to mobilize additional resources from other areas. And in fact, just last week, we were invited to discuss with IFC, with the leadership of Biovaccines Nigeria Limited, how they can be helped. so that Nigeria begins to be on that path to manufacture vaccines. Overall, the issues of corruption are systemic issues. They are across government, across sectors, across levels of government, and you might even say across countries, because even the wealthier countries also have their own issues of corruption. In our own context, what we said, the first pillar of our agenda is to improve governance. And that means getting federal government, state and local government working hand, having a compact that governs expectations between different levels, having structured governance and efficient governance systems, institutions, regulators that are functioning well, being transparent and being accountable with data. And that's why the sector-wide approach that we have actually has that. And I mentioned the disbursement of Basic Healthcare Provision Fund, and the fact that we will have quarterly reports and on annual basis have the joint annual review and the state of health of Nigerians, and of course submit it to the National Assembly and also to the President, so that we take stock as a people and continually improve. There are many audits that have been done. We deployed high-quality accounting firms to look at the institutional capacities of our agencies. We use KPMG, Ernst & Young over the last few months to understand the gaps, because institutions, when they are weak, you have to build them over time. And we believe that having those systems are key to improving the efficiency of utilization of resources and minimize diversions, and being open in terms of the resources that we channel, and calling on other relevant institutions to keep an eye on those resources that are being deployed through states, local government to the primary healthcare centers, so that they are not diverted, and be able to answer the questions. Regarding the second part of your question on the remuneration issue for the health workforce, I have to say that there are lots of health workers in Nigeria that are remaining in the country and doing very well in very difficult circumstances in the realm of local governments or as state employees, sometimes in insecure areas, and many also in the federal government. And we appreciate them. There are a few that choose to go abroad for training. In fact, we approved for some of them to go to other places to be trained. But we expect that when they train, they will come back home. We're expanding the training of those who are around and improving the working conditions. And in the context of the wage reviews that are ongoing in the country, of course, with the Salary, Incomes and Wages Commission, we have made those submissions to have some adjustment of the remuneration of the health workforce. At the end of the day, it's what the economy can afford. At the end of the day, you cannot give what you don't have. And so we have to be very deliberate not to promise things that are impossible to fulfill. Many of the legacy issues are 10 years. Promises that had been made could not be achieved. So it's pointless to keep making promises and setting yourself up when you cannot be able to fulfill them. But one thing for sure, this president is committed to the welfare of the Nigerian workforce, and in our case, in health sector, he is the champion for health human resources in the African Union, in fact, overall. And that says a lot about where his mind is in terms of the health workforce, and he's recognized by that. And our medical and health workers, I think, understand that. That's why they're bearing with us, and we're in constant dialogue with them. When issues arise, we try to resolve them, and we have enjoyed so far relative peace in the sector, which we intend to continue to strive to maintain over time. But it's not something that we can resolve just in a week's time, because it's taken sometimes more than 10 years in the making.
So, Professor Pate, we will hope that this has not been too much of a drill for you. We really came prepared, and in fact, we've not exhausted all of our questions, but we look forward to another opportunity to have you on the program. And we hope that all the investment in preventive and curative health, and indeed in the retraining of health workers that you've talked about, will yield results sooner rather than later. Thank you so much for your time and contribution on the program, sir.
Thank you. Thank you very much.
Yes, indeed. We've been speaking with Honorable Minister of Health, Professor Ali Pate. And when we come back, we switch gears to another subject matter. Stay with the Morning Brief. We'll be right back.